Hey guys, this is Dr. Up. Today we'll be comparing the smallpox with that of the chickenpox. So first we'll be looking only at the smallpox. The smallpox, the incubation period, it is around 7 to 17 days. That is about roughly 1 to 2 weeks. Then how is it transmitted? The transmission is by, there is a respiratory viral shedding. Next, it can also occur through the contact with the fluids. So contact with fluid contact, and the fluid contact is the fluid found on the patient source. Then other thing to note is that it is rare. It is rarely airborne. Next we look at the prodrome. So what is the prodrome? The prodrome is the fever and malaise. There's fever as well as presence of malaise, and this occurs for 2 to 4 days. So it occurs for 2 to 4 days, and this is before the onset of rash. So how is the rash, the characteristics? So rash is it is centrifugal spread. It is a centrifugal spread. Then it is usually on the palms and soles. So it is present in the palms as well as the soles. The axilla, in terms of the smallpox, the axilla is spared. That is, it is free. And the rash on the external surface. So rash occurs in the external surface. Then how is the pock appearance? The pock appearance is there is vesicula. So the vesicula is greater than the pustula. Greater than the umbilicated, and this is greater than the scap. So VPUS. So there is vesicula greater than pustula, greater than umbilicated, greater than the scap. Next we look at the evolution of the pox. So evolution of pox. So this is by synchronous. So it is synchronous. And let's look at the scap formation. So scap formation is nothing but, it will be about 10 to 14 days, and this is after the onset of rash. Next comes the scab separation. So scab separation, this will be 40 to 28 days after the onset of the rash. Next we look at the infectability. The infectivity is from onset of the exanthem. So this is from onset of the exanthem, and this is until all scabs separate. So this was about the smallpox, that is a variola. Now we look at the chickenpox, that is a varicella. So we look at the chickenpox. So chickenpox is nothing but the varicella. So here the incubation period, IP, will be about 14 to 21 days. So this is nothing but 2 to 3 weeks. So how is the transmission? The transmission is that there is a aerosolized. It is aerosolized droplets. There's aerosolized droplets, and this is for the nasopharyngeal secretions. This is from the nasopharyngeal secretions, and it is also by a direct cutaneous contact. So this is a direct cutaneous contact, and this is with the vesical fluid from the skin lesions. This is from the vesical fluids, and this is from the skin lesions. And there is also the airborne transmission which takes place rarely. It is also by the airborne transmission, and this occurs rarely. Next we look at the prodrome. So the prodrome will be, it is minimum to none. It is minimal to none. So how is the rash? The rash will be centripetal. So chickenpox will be petal, that is centripetal distribution, and it is seldom on palms. Seldom on palms and soles. So it is present in palms and soles and appears in crops. Appears in crops. Next, there the axilla, if you see, the axilla is affected, and there is rash on the, there is rash. So rash is present on the flexor surface. Then we move on to the pox appearance. So how is the pox? So the pox appearance, there is a macule which is greater than the papule. This is greater than the vesicula on the erythematous base, and this will be greater than that of the pustular, and this is greater than the scab. So it's a macule, papule, vesicular on the erythematous base, greater than the pustular, and the scab is at the last. So how is the evolution of the pox? So this will be asynchronous. And how is the scab formation? The scab formation will be, it is 4 to 7 days. Scab formation will be 4 to 7 days after the onset of the rash. And how is the scab separation? The scab separation will be within. So scab separation is within 14 days, and this is after the onset of rash. After onset of rash. So the formation was 4 to 7 days after the rash, and the separation was 14 days after the onset of rash. Next we look at the infectability. So infectivity is from 1 day, from day 1 before rash. So it is day 1 before rash until the vesicles. So until the vesicles become scab. And other thing to note is that the scab, this is non-infectious.